Philippine National Guidelines on Physical Activity for Older Adults, Middle Old, and Vintage Old Adults based on the Philippine National Guidelines on Physical Activity. The Philippine National Guidelines on Physical Activity for Older Adults are designed to promote health and well-being among older adults, including those categorized as middle old, 60 to 74 years, and vintage old, 75 years and above. The guidelines encourage older adults to engage in physical activities that enhance their physical and mental health while considering their individual health conditions and capabilities. So here's the following guidelines to encourage older adults in physical activities. First is general recommendations for older adults, physical activity for middle old adults, physical activity for vintage old adults, and the adaptations and considerations of adults. First, we have the general recommendations for older adults. Frequency niya kay older adults should engage in physical activity most days of the week, aiming for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity activity spread across the week. So yung intensity kay moderate intensity aerobic activities like brisk walking, cycling, that recommended for adult adults. So for those who can tolerate it, higher intensity activities are also beneficial. So yung duration kay each session should last at least 10 minutes and can be broken down into shorter sessions for 10 to 15 minute segments. Additional tips for older adults. Hydration. Older adults should stay hydrated during physical activities. Then mag-monitoring ka. Then keep track of physical activity progress and just as needed. If new symptoms gani like dizziness or shortness of breath, if mo-occur gani siya, then it is important to stop and seek medical advice. Ang mental health kay physical activity can enhance cognitive functions and reduce the risk of depression and anxiety. So older adults should try to engage in activities that are enjoyable and stimulating. Second, we have physical activity for middle-old adults, 60 to 74 years. Aerobic exercise. Middle-old adults should aim for at least 150 minutes of moderate intensity aerobic exercise each week. This can be spread throughout the week, ideally in 30-minute sessions on 5 days. So strength training, engaging in muscle strengthening activities at least 2 days a week is recommended to maintain muscle mass and strength. And this can include activities like weightlifting, resistance band exercises, or body weight exercises like squats or lunges. So balance and flexibility. Balance exercises such as standing on one leg or walking heel to toe should be included in 2 or more days per week to help prevent falls. So stretching exercises should also be done to improve flexibility and joint mobility. Third, we have physical activity for vintage old adults. Aerobic exercise. Older adults in this age group should aim to engage in moderate intensity aerobic activity for at least 150 minutes per week gapon. Then, however, for those with mobility or health issues, it may be acceptable to aim for shorter durations of activity or lower intensity activities like walking or chair exercises. So strength training, light resistance exercises are encouraged to maintain muscle strength and prevent frailty. So these exercises can done 2 or more days a week. So balance exercises. Training is critical to reduce the risk of falls. So simple exercises such as standing on one leg, heel to toe, walking or yoga can help improve balance. So rest and recovery. It is important to incorporate rest days and lessons to one's body to avoid overexertion. Last is we have the adaptations and considerations of adults. So health conditions must be physical activity should be adjusted based on any chronic conditions or limitations. So older adults should consult healthcare providers to tailor the intensity and type of exercise to their abilities and health status. So social interaction, group exercises such as walking, clubs, or exercise classes for older adults can encourage social interaction and improve overall mental well-being. So yung safety kay ensure that exercises are done in safe environments to reduce the risk of injury. So for example, kay avoid slippery surfaces and use assistive devices like walking aids if mag-needed siya. That's all for the details to engage physical exercises for adults, middle-aged adults, and vintage old adults.